begin our journey into understanding celiac disease, let's meet some of the leading medical professionals in this field. Experts like Prof. Dr. Alessio Fasano, a renowned gastroenterologist, Dr. David Perlmutter, a neurologist, and Dr. Stephanie Seneff, a researcher at MIT, have all contributed significantly to our knowledge of this condition. Their research and clinical experience help us grasp the complexity of celiac disease, from its immune-mediated roots to its far-reaching effects on the body. With their insights, we can better appreciate why celiac disease is more than just a dietary issue and why proper diagnosis and management are crucial. Celiac disease, sometimes called celiac sprue, is an autoimmune disorder triggered by an abnormal reaction to gluten, a protein found in wheat, barley, and rye. When someone with celiac disease consumes gluten, their immune system mistakenly attacks the small intestine, leading to inflammation and damage. This condition is not just a food intolerance. It's a serious autoimmune inflammatory disease that can affect many aspects of health. Understanding this distinction is key to recognizing why strict dietary management is essential for those affected. Gluten is a complex protein found in wheat, barley, and rye. It consists mainly of two proteins, gliadin and glutenin. When gluten is consumed, the gut breaks these proteins down into smaller peptides. In people with celiac disease, gliadin increases intestinal permeability and disrupts the gut flora, leading to inflammation. This process is at the heart of why gluten can be so harmful for those with celiac disease, making even small amounts dangerous. When gluten enters the body of someone with celiac disease, the immune system produces specific antibodies, such as anti-Gliadin and anti-tissue transglutaminase. These antibodies attack the cells where gliadin has bound, causing tissue damage and a cascade of symptoms. This immune response is what differentiates celiac disease from simple food intolerance, making it a systemic issue that can affect multiple organs and systems. Immunoglobulins, or antibodies, are proteins produced by the immune system to fight foreign substances. In celiac disease, the body produces high levels of IgG and IgA anti-Gliadin antibodies. These antibodies can be detected through blood tests and are crucial for diagnosing celiac disease. Each type of immunoglobulin plays a unique role, with IgA being especially important in the gut and respiratory tract. Recognizing these markers helps doctors identify and monitor the disease. Small intestine is lined with tiny, finger-like projections called villi, which are essential for nutrient absorption. In celiac disease, the immune response damages and flattens these villi, reducing the surface area available for absorption. This leads to malnutrition, even if a person eats a healthy diet. The loss of villi is a hallmark of celiac disease and explains many of the nutritional deficiencies seen in affected individuals. Not everyone who reacts to gluten has celiac disease. Some people experience similar symptoms without the classic immune response or intestinal damage. This condition is known as non-celiac gluten sensitivity, NCGS. While the mechanisms are different, the symptoms can overlap, making diagnosis challenging. Understanding the spectrum of gluten-related disorders is important for anyone experiencing unexplained digestive or systemic symptoms. Celiac disease presents with a wide range of symptoms, from digestive issues like diarrhea, bloating, and abdominal pain, to systemic problems such as anemia, chronic fatigue, joint pain, and even neurological symptoms. Children often show digestive symptoms, while adults may experience more subtle signs like headaches, depression, or infertility. Because these symptoms are common in other conditions, celiac disease often goes undiagnosed for years. Celiac disease rarely exists in isolation. Many people with celiac also develop other autoimmune conditions, such as type 1 diabetes, thyroid disorders, or skin conditions like dermatitis herpetiformis. The risk of additional health problems depends on factors like stress, genetics, and dietary adherence. Recognizing these associations is vital for comprehensive care and early intervention. Genetics play a major role in celiac disease. Most people with celiac carry specific variants of the HLA-DQ2 or HLA-DQ8 genes. However, having these genes does not guarantee the disease will develop. Genetic testing can help assess risk, but a full diagnosis requires clinical evaluation and other tests. Understanding your genetic background can guide both prevention and management strategies. Diagnosing celiac disease can be challenging due to overlapping symptoms with other conditions. Blood tests for specific antibodies, genetic testing, and sometimes biopsies are used to confirm the diagnosis. In some regions, biopsies may yield false negatives, so a combination of tests is often necessary. Early and accurate diagnosis is crucial to prevent long-term complications. Celiac disease can be triggered or worsened by various factors, including surgery, pregnancy, infections, or severe stress. Environmental exposures like processed foods, certain additives, and even some vaccines may also play a role. Understanding these triggers helps individuals manage their risk and recognize when to seek medical advice. Celiac disease is not a one-size-fits-all condition. There are several types, including classic, atypical, silent, and refractory celiac disease. Some people have clear digestive symptoms, while others may have no symptoms but still suffer intestinal damage. Understanding these variations is important for proper treatment and monitoring. Healing from celiac disease involves more than just removing gluten. A 4-step process is recommended. Remove harmful foods, replace with healing foods, repair with supplements, and rebalance with probiotics. Foods rich in nutrients, healthy fats, and probiotics support gut healing and overall health. Supplements like Barlilife and AI Mega can aid recovery, especially when deficiencies are present. Only effective treatment for celiac disease is a strict, lifelong gluten-free diet. This means avoiding all products containing wheat, barley, and rye, as well as being vigilant about hidden sources of gluten in processed foods and even personal care products. Reading labels, preparing meals at home, and being cautious when eating out are essential habits. With time and practice, living gluten-free becomes manageable and leads to significant improvements in health and quality of life. Managing celiac disease requires preparation and ongoing education. Always keep gluten-free snacks on hand, plan meals ahead, and stay updated on new research and products. Support from healthcare professionals, family, and the celiac community can make the journey easier. Remember, being proactive about your health is the best way to thrive with celiac disease.
Welcome! Today I'll show you exactly how to join Beautique and make your first purchase. I'll guide you through every step, from choosing your account type to completing your order. Start by opening the main menu to explore our mission and the products section. You can join as a customer for rewards or as a member to start your own business. The sign-up form is straightforward. Just enter your contact details and shipping information. Members will also provide a few extra details to set up their independent distributorship. Once registered, browse our full catalog and select the high-quality products you'd like to try. Once logged in, simply find your favorite products, add them to your cart, and click Checkout Now to complete your order. You're now ready to start your journey with Beautique. We're excited to have you with us.